Hi, I'm Dr. Jason Cardinali with Dr. C TV. Today, we're going to talk about vitamin D and why is it that it's such an essential vitamin for you. We're going to cover what it is, what the best forms of vitamin D are, what does it do in your body, where is the best place to get it from, what happens when you're deficient, and so much more in this episode of Dr. C TV. So what exactly is vitamin D? Well, vitamin D is a fat-soluble vitamin, along with other vitamins like vitamin A, vitamin E, and vitamin K. So you might be asking yourself, well, what exactly does that mean to be a fat-soluble vitamin? So there are two major types of vitamins. You're going to have the water-soluble vitamins, and then you're going to have the fat-soluble vitamins. Water-soluble vitamins, you'll take them maybe in the morning or so, and within a handful of hours, they're flushing out of your system. They don't stay in your system for very long. Vitamin B is a great example of a water-soluble vitamin. Then you have the fat-soluble vitamins. Now, these ones will actually stick around in your system for a while longer. Now, this is vitamin D. So this is great because if you're deficient in vitamin D, this gives you the opportunity to raise your levels. The bad part is that since this hangs around in your system for a long time, it presents the opportunity for you to be toxic in a vitamin like vitamin D. Now, this is very rare that it happens, and it's typically only if someone has megadosed on vitamin D for a very long time. Now, there are two main forms of vitamin D that we're going to talk about today. The first is vitamin D2. This is also known as ergocalciferol. Then there's vitamin D3, which is also known as cholecalciferol. Now, if you're looking at a supplement bottle, it may not say it on the front label as you're looking at the supplement bottle. Turn it around and look at the nutrition label on the back of the supplement. If it doesn't say it on the front, it should say it on the back. If it does not say it on the back, I would stay away from that particular supplement. Typically, once you go into the nutrition label, even if it doesn't say vitamin D2 or vitamin D3, it will say ergocalciferol, again, which is vitamin D2, or cholecalciferol, which is vitamin D3. So what exactly does vitamin D do? Well, the most important function that it has, and probably the most studied, is going to be its regulation of calcium and phosphate in your body. This is really important for your bones, your teeth, and even your muscles. Vitamin D is also highly anti-inflammatory. It's also neuroprotective, and it's involved to be in the defense of some respiratory ailments as well. That's pretty important given everything that's going on in the world. I'm not going to go into this too deep in this video. There's so much to that I'm actually going to save it for a separate video. So where do you get vitamin D from? Well, your number one source, your very first option, should be the sun. It's free. All you need to do is just go outside on a nice sunny day. Make sure that your arms and your legs are exposed without sunscreen. Now, if you are at higher risk for something like skin cancer, this may not be a very good option for you, and you may have to go another route, like getting it through your diet. So fish is a great example of a food that has higher levels of vitamin D. Trout, salmon, tuna, mackerel, they all have vitamin D in them. You're going to find small amounts in things like beef, liver, cheese, and egg yolks as well. Also, you're going to find fortified foods out there, such as milk and breads. Now, what a fortified food is, for those of you who are not familiar, is if vitamin D doesn't occur in this food naturally, they'll actually put some vitamin D in it for you. So who is at risk for vitamin D deficiency? Well, first off, people with darker skin tones are going to be at a higher risk. Why, you might ask? Because the way vitamin D works and how we synthesize it from sunlight is the UV light actually comes and hits our skin, and it synthesizes vitamin D from a chemical that's already in our skin. So this process does not happen as readily the darker your skin tone is. Also, people who live very far north of the equator or very far south of the equator they're going to be at a higher risk for vitamin D deficiency as well, just because you don't have as much exposure to the sun when the sun is really strong. Also, breastfed children whose mother is vitamin D deficient, they're going to be at a higher risk for vitamin D deficiency. And also keep this in mind, with young infants, usually less than 6 months, we're trying to keep them out of the sun anyway. And if we are taking them out in the sun, we're slathering them with sunscreen. You'll see it on their nose, or we're putting them in UV protectant clothing. So they are also going to be at a higher risk for vitamin D deficiency. Also, older adults will be at a risk for higher deficiency because their skin's ability to synthesize vitamin D does decline as we age. So there's also a category of people with certain conditions which will put them at a higher risk for vitamin D deficiency. These conditions are those that limit fat absorption, such as liver disease, cystic fibrosis, celiac disease, Crohn's disease, ulcerative colitis. Also, people who have had a gastric bypass will also be at a higher risk for vitamin D deficiency. So you might be curious, what diseases might vitamin D be linked to? Well, first and foremost, bone health and osteoporosis is a huge one, but you also have cancer, cardiovascular disease, depression, multiple sclerosis, type 2 diabetes, and even weight loss. So how do you ensure that you're getting enough vitamin D? Well, first of all, you need to make sure that you're eating a diverse diet that includes fish, beef, liver, cheese, egg yolks, and other foods that might be fortified with vitamin D. Also, make sure that you're spending some time out in the sunlight. Lastly, make sure that you supplement. If you live in one of the southern states in the US, then you have accessible sunlight all year round. Maybe you don't need to supplement. But if you live in one of the northern states, you just can't get enough vitamin D from the sun. So it either needs to come from your diet or you're going to have to supplement. Given that there are not many foods that contain high levels of vitamin D, in most cases I find it wise to supplement. If you're looking for a high quality, high potency supplement, I've left a link in the description below. Vitamin D is a very cheap supplement, and given the number of health benefits, I do recommend to the majority of my friends, family, and patients that they do supplement. Well, that does it for another episode of Dr. C TV. I'm Dr. Jason Cardinali, and I will see you next time.